Okay. Now we're still going to be talking about squats here, and the progression we want to talk about now is how do we think about a higher functional task that your patient needs to get back to and how you can modify that. So again, thinking tri-planar, we have the ability to go from a narrow stance to a wide stance. We have the ability to go from feet together to feet in a more sagittal plane motion. And we have the ability to rotate our feet in, or we can rotate our feet out. And there are probably hundreds of different squat positions that you could go into in order to challenge your patients. So we could even start here with your feet together, okay? And we could just do many small squats here, but then you could think about having them work in a transverse plane motion, rotating with their arms to get a little different stress into their foot and ankle, okay? Now, I could widen my stance and go into kind of a normal squat, but if I want to get more if I want to get more eversion on my right leg, I can reach down to my opposite side, okay? And that's going to drive my knee in, it's going to drive my foot and ankle into a greater amount of eversion. If I want to go into more inversion, I could go into a squat and reach the opposite direction. I'm going to externally rotate my femur. That's going to cause my subtalar joint to invert while I go and reach to this opposite side. Okay? You can move into the frontal plane, working, if it's my right leg, I have less dorsiflexion, or I can put my right leg back and I'm going to have a greater amount of dorsiflexion that I'm going to challenge there. Frontal plane with rotation, okay? I could go into a squat here. A lot of times people will be going up and needing to change direction and cut, and they're going to come into a squat and then come back. So you could go into a squat with internal rotation of your front leg to challenge your ankle in that stress. Okay? Lastly, you can work on rotation, which is sometimes different from what us as physical therapists will think about, but you can think about external rotation, which not too different. And then what about internal rotation? We don't train that often, but if you look at some motions that are return to sport individuals are getting back into, they may end up going into an internal rotated position, and if that's what the motion calls for, then they need to be able to control that to some degree.